So as Kendall mentioned, I'm presenting on type 2 diabetes and the effect of the ketogenic diet. So as we get started, we're going to start with why I chose this topic. We'll go through a brief summary of type 2 diabetes and the ketogenic diet. We'll talk about my research articles, and then we'll wrap it up with an additional discussion and some takeaways. And of course, time for questions. I'm sure there's going to be questions. All right, so I actually chose this topic because I really enjoyed my outpatient rotation. I did it through Bellin Health in Green Bay, and I worked with RD who is also a certified diabetes educator. So we saw a lot of patients with diabetes. So that really piqued my interest about what we could do for our patients in that setting. How many of you have heard of the keto diet this far? Raise your hand. Okay, so like everyone. So that's why you're here, because the rest of the morning the room was pretty empty. So obviously we all want to know, like, what's the scoop on the keto diet? And not only are we interested in keto, but I think that as nutrition professionals we have a vested interest in learning more about what we can do to help treat diabetes. In 2016, the CDC reported that 8.6% of US adults have type 2 diabetes. So that equates to about 21 million people that know that they have diabetes. That's not counting the people that don't know that. So that's pretty incredible. All right, jumping in. So type 2 diabetes is the inability to use or produce insulin. So throughout my presentation, that will look like insulin resistance. That's what I'll be calling it. To allow cells to uptake glucose from the bloodstream. Type 2 diabetes is the most common form versus like type 1 diabetes. And it often occurs in middle-aged or older persons. And it results in other chronic disease states like neuropathy, and is closely linked to other comorbidities like chronic kidney disease and cardiovascular disease. So one term that I want you all to be familiar with as we're going through the presentation is HbA1c. So that is an abbreviation for hemoglobin A1c, and that stands for glycated hemoglobin. So that occurs when blood sugars are chronically high, and glucose actually has a chance to chemically bond with red blood cells in the bloodstream. So the significance of this is that it's a measure of average plasma glucose over the previous 3 months. So it gives us more of a long-term picture of what plasma glucose has been looking like. So it's measured in percentages, and 6.5% is a clinically significant value for diagnosing diabetes. So keep that in mind as we go through the presentation. All right, so a little review on the keto diet. You've probably all heard that it's a really high-fat diet. It has moderate protein and low carbohydrates, like very low carbohydrates. So for the very first study that we'll be talking about, what they did was they limited carbohydrate intake to about 5% of daily intake. So that equated to about 30 grams per day, mostly coming from non-tuberous vegetables and berries. So that is a very limited carbohydrate diet compared to what most people in outpatient clinics would recommend. Like for women, for example, they get 30 to 45 grams of carbohydrates per meal. So that's 3 meals a day plus 2 snacks, about 15 grams each. So limiting your total daily intake to less than 30 grams is a big deal. So my first study is called the Improvement in Glycemic and Lipid Profiles in Type 2 Diabetics with a 90-day ketogenic diet. The purpose of this study was to determine whether a 90-day low carbohydrate diet could improve markers of insulin resistance and type 2 diabetes. The primary outcome was hemoglobin A1c, and secondary outcomes included body weight, which they also measured in BMI, blood pressure, both systolic and diastolic, liver enzymes, AST and ALT, and blood lipids, including LDL cholesterol, HDL cholesterol, and triglycerides. So they had a cohort design to this study. So what they did is they compared the participants at the end of the study, which again was 90 days, to where they started at baseline. There were 11 participants in the study. They were all female. They were all volunteers, so they knew what they were getting into. The inclusion criteria was that they were age 18 through 45. They had a recent diagnosis of type 2 diabetes. Again, that hemoglobin A1C level was over 6.5%. And any feature of metabolic syndrome, including hypertension and dyslipidemia. The exclusion criteria included if they were using medications to control their diabetes, had previous disease diagnoses. I know that's really vague, but that is exactly what it said in the study. So they weren't super clear about that. And if the participant was pregnant or nursing, they were not allowed to participate in the study. So again, as I mentioned, it was a 90-day study. So they started with an initial individual visit to give them diet education. Then they did weekly visits throughout the entire 90 days. And that, again, included discussions about dietary adherence. And they measured plasma ketone levels at those weekly visits. So the diet that they were on, as I mentioned before, was a diet that consisted of about 5% carbohydrates, 20 to 25% protein, and 70 to 75% fat. So their method was to control carbohydrates, and then eat their protein, and fill with fat. So that was the idea there. All right, so what they found was that over 90 days, these women had an average starting hemoglobin A1C of 8.9%, and at the end of 90 days, they lowered it to an average of 5.6%. So that is pretty staggering. They also experienced significant reductions in body weight, and subsequently reductions in BMI, reductions in systolic and diastolic blood pressure, and triglycerides. They also experienced a significant increase in HDL cholesterol and a significant decrease in triglycerides. So that is actually relevant because, as I mentioned before, diabetes is closely tied with cardiovascular risk. So what this study mentioned was that the triglyceride to HDL ratio actually decreased altogether, and that's a more telling indicator of heart disease than LDL cholesterol alone. And LDL cholesterol actually had no significant changes, and there were also no significant changes in AST or ALT values. One thing I want to note on this slide with AST and ALT is that they only provided results from 8 participants, and while they noted a downward trend, again, it wasn't significant. So that was just a really odd part of the study. In conclusion, the authors decided that this diet induces a favorable metabolic state, particularly in the reduction of hemoglobin A1C. So as you saw, that huge jump from 8.9% down to 5.6%. And it had the added benefits of decreasing body weight and blood pressure. So the strengths, the cool thing about the keto diet is that if they're following the keto diet, there's gonna be ketones in the urine. So at those weekly visits, they were measuring plasma ketones. So I know I just said the urine, but it was plasma ketones. So they were able to tell that the participants were actually adhering to their diet. And there was a 0% attrition, which is pretty cool. Limitations, the sample size, definitely only 11 people. the ability to generalize to the general public. Not everyone's a woman, obviously, so the fact that there was no male representation didn't lend well to the study, and there was no plasma insulin data. Overall, this study got a negative EAL worksheet grade. I'm just gonna take a break and take a drink of my water, otherwise I think I'm gonna have a coughing fit. All right, so this study was a 12-month outcomes of a randomized trial of moderate carbohydrate diet versus very low carbohydrate diet in overweight adults with type 2 diabetes, mellitus, or prediabetes. Say that 10 times fast. So the purpose of this one was to compare the health impacts of the keto diet to the moderate carbohydrate calorie restricted diet on type 2 diabetes. So that moderate carbohydrate calorie restricted diet is what we would typically think of as the American Diabetes Association Create Your Plate diet. So the plate method diet, half veggies, quarter starch, and then a quarter of lean meat. So the primary outcome in this one was hemoglobin A1C as well. And they also measured blood lipids, markers of insulin resistance, and weight. So this was a randomized controlled trial. They had 34 participants, so far we're doing better than the last one. Their inclusion criteria was that the participants were age 18 or older, they didn't have a cap on the age, BMI of 25 or above. Again, they wanted to know the effects on overweight people, and had a hemoglobin A1C level of 6% or greater. So you'll notice in this one that it's not the 6.5%, so it includes people in the pre-diabetic range as well. Then they had a whole host of exclusion criteria. So if they were using insulin or more than 3 glucose-lowering medications, if they did not speak English, which was an interesting one, if they had mental health or other medical conditions, and like I said, a whole host of exclusion criteria. So they were just trying to take out other confounding factors that would affect the intervention of diet and behavioral intervention. All right. So this study lasted for 12 months, and as I mentioned earlier, they did a behavioral intervention. So this included information about the importance of sleep and physical activity, and also included education about positive effect, so kind of being like self-forgiving, and about mindful eating. They followed the very low carbohydrate diet, so their range was about 20 to 50 grams of carbohydrates per day, so a little more lenient than the last one. And they took twice weekly measurements of plasma ketones. And they did mention that as they took it the first few months, and they were a little bit vague as to what happened after that. The control group also lasted for 12 months, and they also received the behavioral intervention therapy. And again, we're on the moderate carbohydrate and calorie restricted diet. I do want to mention that throughout this intervention, they had 19 classes, so it started out more intense in the beginning, and then they transitioned to their diet by the 4th week of the study, and then the classes kind of tapered off, like once they got the hang of it, they kind of let them loose, but then followed them for the whole year. So what they found with their primary outcome, hemoglobin A1C, was an average reduction of 6.6% to 6.1%. So bringing it back down to that pre-diabetic range. There you can see the p-values. So both of those values were significant between the intervention and control group at both 6 months and 12 months. So it's pretty cool that they also saw a change at 6 months. Overall, again, they saw significant reductions in hemoglobin A1C body weight, and BMI. They saw a significant decrease in LDL cholesterol at 6 months only, so that part was kind of interesting. And they also saw non-significant changes in triglycerides, LDL, and markers of insulin resistance. In conclusion, they concluded that overweight adults with prediabetes or type 2 diabetes could benefit from a very low carbohydrate diet by improving their glycemic control with less medications. They had high retention rates and they had fair dietary adherence, so those were two strengths of the study. Again, the dietary adherence could be measured by the plasma ketone levels. Limitations included the sample size, so again, only 34 people. And I pulled out a limited understanding of the effect of the dietary intervention alone. Kind of leaves me to wonder what would have happened if the behavioral intervention wasn't there. What part did that play? And this study also received a negative overall grade. All right, so here's another mouthful for us. This was an online intervention comparing a very low carbohydrate ketogenic diet and lifestyle recommendation versus a plate method diet in overweight individuals with type 2 diabetes. This was a randomized controlled trial. So this one is going to look a little bit familiar to you guys. So this was actually a follow-up study to the previous study. So it was the same authors who conducted this third study as the second study. So the first one was like kind of a pilot to see if their interventions would actually work. And then this one was a test to see if they could get the same results with an online intervention. So kind of the same purpose, comparing the very low carbohydrate diet to the moderate carbohydrate and calorie restricted diet. Their primary outcomes in this one were hemoglobin A1C and body weight. And their secondary outcomes were blood lipids and aspects of psychological health. So the aspects of psychological health is kind of a new thing in this study compared to the last one. It was a randomized controlled trial. They had 25 participants in this study. The inclusion criteria were that the participants were ages 18 or older, had a BMI of 25 or above, and a hemoglobin A1C of 6.5 to 9%. Interesting that they put a cap on this one, and had regular access to the internet. So because this was an online intervention, they needed to have regular access to the internet to receive the education materials that they were emailing to the participants. And the exclusion criteria, a lot shorter on this one, were the use of diabetes medication other than metformin. So this intervention lasted for 32 weeks. The intervention group received the behavioral intervention. So they received that for weekly for 16 weeks and then bi-weekly for 16 weeks. It included information about physical activity, sleep, positive effect, and mindfulness. And they did a once weekly measurement of plasma ketones, which was kind of interesting because they were sent at-home testing kits, again, because this was an online intervention. The researchers weren't there doing that for them. So I'm not sure what kind of training they received on that. They also measured their weight. So they were sent a scale to their house, like a standardized scale to do their weights. And the way that they were made to record their weights was to stand on the scale and have their weight digitally displayed, and then they had to take a picture with their feet on the scale with the weight at the same time. So I thought that was a good control. Same diet, so 20 to 50 grams of carbohydrates per day. That is their definition of the keto diet in this study. And then with the control, they were followed for 32 weeks as well, and they didn't have the behavioral intervention. So they were just receiving information, education, about a low-fat diet with emphasis on vegetable intake. They were sent information weekly for 4 weeks, and then they got information, every 4 weeks after that. So again, for the total of 32 weeks. So what they found was that there was a greater reduction in hemoglobin A1C and body weight in the intervention group versus the control group. They found a significant decrease in triglycerides at 32 weeks only, so that was the end point of the study. They didn't see it at the midpoint, which would have been 16 weeks. And they didn't see any significant changes in HDL or LDL. So in conclusion, they found that the online intervention was effective in supporting weight loss, lowered hemoglobin A1C levels, and lower triglyceride levels. Again, the strength was the measured adherence to the diet, although I'm a bit skeptical, again, because they were sent at-home testing kits, and I'm not sure what kind of training that they received to do that. I'm not sure if you can mess up on that, but just a point. Again, the limitations, this was another small group of people. They did have a pretty high attrition rate. So in the intervention group, they had an attrition rate of 8%, and in the control group, they had an attrition rate of 46%. So in the discussion part of that study, they actually talked a little bit about how they thought the plate method was maybe a little bit harder to follow, and that's why they suspected that some more people in the control group dropped out than in the intervention group. And again, as I mentioned, there was no lifestyle intervention provided to the control group, so again, we're kind of left wondering, what effect did that lifestyle intervention have on these markers that we measured. That one was also a negative grade for the EAL worksheet. So in summary, I just wanted to wrap it all up for you guys. So we got the sample size, duration, and significant markers. So I only put arrows next to things that were significant in these studies. But what they all have in common is that they all saw a downward trend in hemoglobin A1C and body weight by following a very low carbohydrate diet. All right, so what does this mean? So the diabetes standards of care was actually updated this year in 2019. The last time that I saw it was updated was in 2013, and here's what they had to say. That research indicates that low carbohydrate eating plans may result in improved glycemia and have the potential to reduce anti-hyperglycemic medication for individuals with type 2 diabetes. So that's pretty cool that a very low carbohydrate diet could maybe help some of these people get off their medications that oftentimes they have a hard time affording anyways. So we have support for this in the updated diabetes standards of care. I also wanted to touch a little bit on what oral medications for diabetes can do. So metformin is a common diabetes medication that is prescribed to type 2 diabetics. And it does have some negative side effects. So a lot of people will report that they experience diarrhea when taking this medication. And overall, it usually results in an average 1.5% reduction in hemoglobin A1C. So if we could see as staring of a result as the 8.9% to 5.6% that we saw in the first study with a diet intervention, that looks a lot better than the 1.5% reduction that we could see with an oral medication. Takeaways. So my favorite part about these studies was that there was a measured adherence to the diet. So sometimes in diet studies it's really tough to rely on subject-reported data, but this one made sure that we knew they were following their diet because you can't really fake plasma levels. It also showed that lifestyle intervention is effective. So that was exciting to me because it shows that as nutrition professionals, we have a place in the treatment of diabetes. And this is about meeting patients where they're at too. So with an online intervention, a lot of our patients are spending time on their phones, so how can we reach them? Is that effective? That last study said yes. I also think it lends a hand to the fact that people have access to a lot of information. So sometimes clients might come in with the idea that they're gonna do the keto diet and you don't have any control over that. Has anyone ever had that happen? No one? But if I was ever in that situation, okay, they're gonna do the keto diet, so how can I help them do it to the best of their ability? How can I help them do it healthfully? In future studies, I'd like to see larger sample sizes, definitely, and I'd like to see the results be able to be more generalizable to the general public. So I forgot to mention it was actually in the third study, I think. More than half of the participants were Caucasian, so there wasn't really a good racial demographic there either. So we need to definitely get some more information about that. And I would like to see more defined control groups and separation from the behavioral interventions to see what the effect of the diet alone can do. If it's practical for people to follow, is what I'm thinking. With that, I'll leave it open for questions.